fallen behind on bills like rent, utilities, car payments, or insurance. And others told us about their intention to pay off debt, schedule a medical procedure that they had been putting off, completing a home or auto repair that they had not previously been able to afford, buying their children new snow boots or school supplies, or putting the money in the bank to establish an emergency savings account. The earned income tax credit was a really great step forward, but we know it's not enough for working families. More support is needed in order to achieve stability. The working parent tax credit, in the support of cash and not a program, allows for greater scale to reach more working families, and more importantly, it puts the trust in the families to make the best decisions for themselves with that money. And we truly believe that that is critical. We know many from talking to the clients that we serve would intend to use that on childcare or pay for other critical bills in their household. This means that parents, mainly women, would re-enter the workforce if these dollars allowed them to cover the cost of childcare. This would be beneficial for our employers across the state who are struggling to fill roles and have a positive ripple effect into the economy with more dollars being spent on childcare and other items in our communities. This could be life-changing for many families, allowing them to build a stable foundation that enables them to achieve economic stability and mobility for themselves and pass that along to their children. For the past several months, I've been fortunate to be a part of the steering committee for the Working Parent Tax Credit Coalition. This coalition is a group of over 100 leaders and growing from various organizations across the state, and we share a common goal of wanting to see greater support for working families. Last year, we co-authored a letter to the governor and to our legislative leaders calling for a large refundable credit direct to working parents to help them with childcare and other critical expenses. So I'm really happy to represent that group today. We really believe that Michigan has the opportunity to be a leader across the country in these efforts. And now I'm going to turn it over to Senator Santana.
Thank you all for being here today. To every parent juggling work, caring for little ones, and making ends meet, we see you, we hear you, and we are here for you. Raising children, especially a newborn, has become unbearably expensive. For too many, what should be one of the most joyful times in a family's life has become a financial struggle. That's why we are here today to begin the work of expanding RX Kids, the first in the nation program already making a difference right here in the state of Michigan. I know Dr. Mona will provide deeper dive into the program, but here is what you need to know. RX Kids provides financial assistance to new mothers during pregnancy and throughout the baby's first year of life. It launched in Flint, and the response has been overwhelmingly positive. We've heard directly from mothers about the difference this support has made, allowing them to spend more time with their babies instead of picking up extra shifts. Our Kids has helped mothers to afford diapers, formula, and childcare without the constant stress of making ends meet. As a parent myself, I understand these challenges. I have 3 children, and they are older now. And I also know firsthand how that cost of diapers, formula, and childcare has only continued to rise over the years. A program like RX Kids would have been a game changer for my family when my children were little. I also know that many families feel the same way. That's why, as the chair of the Department of Health and Human Services Appropriations Subcommittee, I have worked with Senator John Cherry and my other colleagues to make sure that we secure funding in the state budget to help get this program started. And we've already had tremendous benefits for families in this Flint area. And this year, this program is going to expand to Kalamazoo counties as well as the eastern Upper Peninsula. But we cannot stop here. Financial challenges don't stop in cities or counties. But I've heard from other mothers in my district as well, who also are doing everything imaginable, planning, saving, and budgeting, yet still struggling to keep keep up with the ends and meeting. They need more support. They need this program, and we need to provide it to them. Now it's time to take the next steps. With the Senate Democrats' new plan, we have the opportunity to expand RX Kids statewide and ensure that every family, no matter where they live, has the building blocks they need to thrive. I look forward to working with my colleagues and community partners, and of course, the visionary leaders behind this, like Dr. Mona Hanna, who I'm now pleased to introduce. Dr. Mona.
Thank you. It is amazing to be here. Thank you to all the senators for their leadership. Thank you to Governor Whitmer, who has championed this program. Thank you to Senator DeMuse up in the Upper Peninsula, Northern Michigan, who's also been a champion of this program. It is so exciting to be here, and it's so exciting to hear everybody repeating what we all know. The hardest job that our families have in Michigan is to be a parent. It is so hard to be a parent. I am a practicing pediatrician in Flint, Michigan, and for so long I have wished for the ability to help my parents, my families, with one of the hardest things, and that is to overcome poverty. When babies are born into and grow up in poverty, it is a pathogen. It makes kids sick. It impacts their entire life course. It impacts their potential. Yet we don't have to do that anymore. And we're not doing that anymore thanks to the leadership of these amazing folks. As was mentioned, RX Kids is a prescription for health, hope, and opportunity. It started in Flint over a year ago. We have prescribed over $7 million to over 1,500 families in Flint. And those dollars are going to exactly what you heard. They are going to baby supplies. That mom-baby period, that time of pregnancy, infancy, is the poorest time in the life course. Towards the end of pregnancy, moms often have to come out of the workforce. We have no paid leave policies in this country. Babies are expensive. We've heard that babies need so much stuff. It's like the smaller they are, the more stuff they need, up to $20,000 in that first year. And during childbirth is actually the poorest time in the entire life course. Can you imagine when our families are having a baby is when they will be poorest in their entire lives. And that is the most critical time of child development. What happens in that brief window of that maternal infant period shapes your entire life course. That is when we should be surrounding our families with resources and love and enrichments to make sure that they can grow up healthy and successful. And that's exactly what RX Kids is doing. Families are using this money. It is a proven, effective, and efficient program. They're using this money, number one, for baby supplies. And when you break down baby supplies, it is diapers, and it is wipes, and then it is feeding supplies, and then it is changing things. Then they're using it for rent and housing and food and transportation and childcare. And this is all based on global evidence. 70% of countries do some sort of child cash transfer. We did it in this nation during the expanded child tax credit of 2021 when we dropped child poverty to its lowest level. So this work is not rocket science. This is basic. This is how we care for each other in a society. So in Flint, we have near 100% take up, which is amazing. Every mama and baby that should be in this program, that is eligible, is in this program. We are seeing massive improvements in housing stability. We had no evictions among low-income families, which is amazing. Improved food security, improved maternal mental health, a decrease in postpartum depression, improved well-being. Our families feel less stressed, more loved, more valued, more respected, more empowered. They have more trust in government and more trust in healthcare, which is really amazing to be from Flint for our mamas to say they have more trust in healthcare, but they do because of this program. And then based on big data from vital records, birth certificate data, our mamas have more prenatal care. They're coming to prenatal care earlier. They have less smoking in the third trimester. We have improvements in birth weight and gestational age. All these things that have been so hard to move, we are moving because of this program. This program is working. It is effective. It launched in Kalamazoo less than a month ago to tremendous success. It launched in 5 counties in the eastern UP a week ago with already 150 folks enrolled in the eastern UP. There is not a day that goes by where I don't hear from somebody from the other parts of our amazing state that say, we want this too. We are struggling. I'm a teacher in Grand Rapids and I can't make my ends meet. I'm a single mom in Bay City and my family could use this too. So I applaud the leadership here for recognizing that we can easily expand this absolutely efficient and effective program to every mama and every baby. And before I close, I want to introduce you to Rex. This is the official ARCS Kids spokesbearer. Thank you so much.
Thank you so much, everybody, for being here today. You heard just some of the incredible stories from two of the providers in our state who are doing such great work for our families. Anybody who is a parent knows that you would do anything for your child. And these are some great tools ahead of us that will allow more parents to be able to focus on being a parent and doing everything they can for their child. With that, we will open it up for a couple of brief minutes of questions. Certainly. So we are starting the budget negotiation process at this moment. Part of the reason for having this press conference today is to really lay out a vision for the public. We know how popular and successful this program is, and we want to let people know this is what we are fighting for as a stark contrast to what we are seeing come out of the State House right now, and this will be a big part of budget negotiations moving forward.
House Republicans just passed their income tax proposal yesterday. I think that just makes me want to ask, what are you willing to give in order to get?
As we mentioned, this is the start of the budget negotiation process. What I think we are all very glad to see is that our House Republican colleagues also understand the importance of childcare and families, and we look forward to a robust negotiation.
Do you think that this would be more beneficial than a tax cut?
That is part of negotiations. I think, as we mentioned in remarks, what we know is trickle-down economics doesn't work. And at a moment when the federal government is prioritizing tax cuts for the wealthiest 1% of Americans, what we are saying to Michiganders is that here in the state of Michigan, Democrats want to fight for tax cuts for you, not people who don't need them.
Is the tax credit proposal for parents of young children the same as what was introduced last session?
It's very similar to that. And just to the previous question, I would say that puts directly $5,500 back into the pocket of a parent or a family who has a child 3 years or younger, right? We know that the income tax cut that has been discussed in the House doesn't put anywhere near that amount of dollars back into a family that needs those dollars at a time when, as you heard today, the first year of a child's life is $20,000 to that family. I've lived through it. I've been through it. It's challenging, and so we know this will have a much greater impact, I believe, than what they're talking about there. I'm sorry.
So just one follow-up on that. So I'm looking at the fiscal analysis of the bill from last session. They said that proposal would cost $900 million to $1.1 billion. You have the House proposing shifting $3 billion in current revenues to roads, talking about an income tax cut. How will all of these things fit together? Because it doesn't seem like there's enough money to do all of these.
Well, I would say, we know that a budget is a statement of our priorities. And regardless of political affiliation, I think every one of us has people in our communities that will benefit from these policies that we're talking about today. And this gets the support and the help directly to the people that I think need it most here in our state. And so I think we need to have that conversation through the budget process and make sure the budget is reflecting our priorities. And I think these policies that we're talking about here today are our priorities that we want to set forward.
If I can just add, any investment in early childhood has a massive return on investment. For something like ARCS Kids, it's a trickle-up program. Those dollars get spent locally, so it's an economic development program. But also in the long run, you have less costs in child welfare because it's preventing child welfare involvement, less abuse and neglect. You have less Medicaid costs because you have less NICU admissions and premature babies and all these other health complications that we're not going to have. You have less costs in special education and criminal justice. Those societal savings may not be seen right away, but any investment in early childhood reaps a massive return on that investment.
We are coming up on time this session. If there's one more
So we've been talking about this a lot. I've done multiple events in my community over the last few weeks. I know my colleagues have as well. And what we've seen is a flood of people who are anxious and concerned. You know, our state budget is made up 42% of federal dollars, which is our tax dollars that we pay to the federal government, that we expect and rely to come back into our state. So what we are encouraging everybody in the public to do is, as you hear about programs like this or potential cuts to programs in your community, whether it be education funding, we know that $2 billion would be lost to our school education funding if the federal Department of Education goes away. Contact us, share those stories. We just had an oversight committee hearing talking about some of the impacts of federal cuts, and that has to be what we prioritize moving forward. We've also seen the federal government very quickly rescind on some of their threats when they've heard public outcry. So what we are here to say today to parents all across the state of Michigan, if this is important to you, tell us and tell your elected officials all across the state not to cut funding for these federal programs.